While we are talking about the geriatric anxiety, one should know that there are multiple causes to the development of this anxiety disorder in this older age group. We've already discussed that there are multiple medications that can cause anxiety disorders in these individuals. It can range from the substance misuse of these individuals, then there can be some prescriptive medications that themselves can cause the anxiety disorders in these individuals. So one should be very careful when you're evaluating these individuals for the causative factors that are basically the baseline cause for the anxiety disorders in these individuals. One of the causes can be the comorbid conditions that the patient is suffering from. So when you have a patient, he or she walks into your clinic and you have diagnosed or categorized that patient as suffering from anxiety disorders, evaluating that patient, conducting the preliminary tests are again very important over here, just to rule out if he or she is suffering from some sort of comorbid conditions or not. These comorbid conditions can range from the different systems that can be the cardiovascular system, the respiratory system, and then we can have the central nervous system disorders that can even present as the anxiety disorders. The symptomatologies are quite similar and sometimes quite difficult to differentiate between these conditions. So the differential diagnosis is made, and then we have to work on that differential diagnosis just to know the baseline or the underlying cause that is giving out the symptoms, just like an anxiety disorder in the geriatric age group people. So in this section, basically, we are focusing on the prevalence of anxiety in the geriatric age group. And then we're moving on to this fact that it is basically not quite recognized in the elderly people. So sometimes it is an underreported phenomena. People won't usually come up with this phenomena or won't usually go to the clinical psychiatrist just to idealize the situation that it's basically a common factor to get depressed or get anxious in the old age group. So the treatment guidelines which are usually present and they are usually sought to when you're helping some elderly person come out of that anxious situation, we'll be discussing all of these treatment modalities over here, ranging from the psychotherapies, the counseling sessions, and even the pharmacotherapies that are devised for such anxiety disorders over here. So the anxiety disorders that can manipulate as the medical conditions, or the medical conditions that can manipulate as the anxiety disorders, they'll be discussed over here. The disorders can range from the cardiovascular system, even the CHF, the myocardial infarction, the arrhythmias, and the endocrine disorders such as the hyperthyroidism, hyperadrenalism, and then we have immunologies such as systemic lupus erythematosus, which is basically abbreviated as SLE, and then we have rheumatoid arthritis. All of these immunologies can even represent or present clinically as the anxiety disorders. Then we have TAs, then we have the lung diseases such as asthmas, chronic obstructive pulmonary diseases, the gastrointestinal diseases such as Crohn's disease, ulcerative colitis, and then we have the neurological diseases such as the cardiovascular accidents, and then we have the multiple sclerosis on the other hand, and then we have the multiple gliosis on the other hand. We have the neurosyphilis, and then we have the post-concussive syndrome, which is after the head traumas that occurs, and due to these concussive or due to these concussions, some of the symptoms of anxiety occurs after this. So if we have a look at the causative factors of the comorbidities, they're basically ranging from the different systemics of the body, ranging from the cardiovascular, endocrine, immunological system, lungs are even involved, or the gastrointestinal tract is sometimes involved, and then we have even the neurological diseases on the other hand. So evaluating the patient from system to system is again very important. Even the general physical examination would reveal the specific factors if he or she is suffering from some sort of an ailment of a specific symptom. If that is basically cluing towards a specific symptom, then some of the blood tests or some of the CTs or MRIs, imaging techniques are then used for the further investigations of these individuals and patients, just to rule out any comorbidities that can cause anxiety-like symptoms in these individuals. Then we have the prevalences in the elderly. Many studies note the anxiety symptoms, impairment in the quality of life is quite prevalent in these individuals who are suffering from anxiety disorders. They are related to disability in some cases. Anxiety about the existing disability, it can be any disability that was previously present in those individuals, but now it is basically causing that anxiety disorder in these individuals. Then we have anxiety that can lead to disability, and then there is the steeper cognitive functions that declines if dementia is untreated. So we've already discussed and gone through the details of dementia. That is basically the organic brain disease, and even this dementia can cause these anxiety-like symptoms in these individuals. So usually, it is not commonly seen as a part of a mood problem. Various scenarios can relate to the anxiety disorder, such as a previously existing anxiety disorder, a new onset anxiety disorder, or it is a mildly present anxiety disorders. All of these scenarios basically make this condition quite unrecognized in the elderly people. Then we have older people can't meet the criteria usually. Usually they're not able to fill up the questionnaires or give you a detailed history regarding their past due to their loss of memory, and that can basically, the criteria cannot be fulfilled in these conditions. Less is needed basically to leave the ones, and that is basically due to the social network of these individuals. And then we have agoraphobias, that is basically the fear of falling, or it is very common in the geriatric patients. Anxiety doesn't disrupt the functional life in these individuals. When you're working up anxiety, it's very important to clinically evaluate these individuals. Laboratory tests are performed. Obviously, samplings can range from blood tests, urine samples are even taken. Then we have basically, we're going to rule out the common conditions that can lead to the anxiety disorders. Then a complete and a detailed history taking is again very important. One should take the past medical, the past surgical history, and then we should move on to the medications that the patient is using, the alcohol use. If he's a chronic alcoholic, or if he's a patient with alcohol intoxication, that has to be highlighted. Family and social history is again very important over here. Then the physical examination of the individual is done in detail as well. First of all, we'll note down the vitals of this individual, ranging from the blood pressure, pulse rate, respiratory rate, temperature of the individual, and then we'll move on to the general physical examination, and then the systemic examination will reveal the details about the comorbid conditions if he or she is suffering from any one of them. Trembling, racing heart, rapid breathing, sweating, and dry mouth. These are the usual conditions that arise after the sympathetic outflow. So basically, it can be even in a normal situation, but if it is an abnormal or a pathological situation, that has to be highlighted. Mental state examination has to be carried out through questionnaires, or it can be through the history-taking phenomena as well. Then poor attention, distractibility, much motor movements, easily startled, wide-eyed, and feeling of dread, feeling of fearfulness, or extreme worry are the characteristics that are noted down in these individuals. Rarely it requires the special psychological testing, so it doesn't require usually on the preliminary history taking. It would be quite evident whether the person is suffering from anxiety or not. Interventions for the anxious patients are structure is important, since anxiety relates to the loss of control. Many cognitively impaired residents improve with a high level of structure because their anxiety is lessened. And then we have the exercises also devised for this purpose. Physical activity burns off anxiety, and pacing may be the residents' basically way of lessening anxiety. So some of the exercises are also given to such old age group people. And then we have the rote activity, repetitive actions from knitting to saying the rosary to rocking in the chair, brief regular appointments with a trusted staff. And then for patients who wish to discuss anxiety, we have reality testing, family phone calls, and then we have stimulated presence of the individuals or the loved ones. So in this section, basically, we highlighted the key points that are going to be there when you're evaluating a patient of anxiety disorder, and how do you basically go about and treat these individuals. So that is the end of this section. Thank you for watching sqadia.com.